Good morning, everyone. Good morning. Before I start, I want you to give these extraordinary medical students, activists, a big, big round of applause. First and foremost, I'd like you to recognize your power and privilege as health professionals in this room today. You've worked very hard to get to where you are. You may wear white coats and stethoscopes around your neck. You may serve as nurses, nurse practitioners, social workers, interpreters, and many other roles for patients in New York City and beyond. You are invited into the most intimate chambers of your patients' lives, not as innocent bystanders or witnesses, but as an active participant every single day. And this sacred role comes with immense responsibility and privilege. Your voice is powerful. Andre's voice is powerful. All of your voices are powerful, more so than you may think. And you are in a position to use your voice and use your role to advocate for your patients, who are first people with spouses, children, hobbies, desires, and dreams, just like you and I, and then patients with diseases that you will attempt to treat. I'll tell you a little bit about myself and my path to finding my own voice. My parents are from a small country called Guyana in South America. They are the descendants of Indian indentured servants, and they were brought from India to Guyana to work on sugar plantations, alongside Afro-Guyanese who were brought from Africa to Guyana to also work alongside them on plantations. During socioeconomic and political upheavals in the 1970s and 1980s, a large group of Guyanese moved to Richmond Hill. I grew up in Richmond Hill, Queens, not too far away. I urge you all to visit. I grew up in this community, an underserved, underinsured, diverse community of color. In this community, voices were often silenced, ignored, targeted wrongfully, or simply unheard. Schools were overpopulated, failing rates were the highest in the country, basements were constantly being raided, and people were fearful of deportation, not yearly, but every day. Police cars would park outside the playgrounds of elementary and junior high schools. People would await their deathbeds before seeing a doctor for any symptom at all. I stand here and tell you all of that, but also tell you that Guyanese people are among the brightest, most cultured, most healthy, and most ambitious people that I know. I recognized very early on that institutions and people would enter our community around election season, or when research grants were given to study underserved populations. Somehow, we would hear about these projects after it was too late to provide any meaningful input. For me, it was then that I learned what advocacy truly is, which is speaking loud enough for even one person, one other person to hear you. When your voice may be stifled, when you feel like you can't dig deep inside of you and find that courage, but you speak anyway, it is then that you speak up for those you care about most. And it is then that you're engaging in advocacy. In medical school, I fast forward many years, I was fortunate to serve as an intern for the East Harlem Community Health Committee, a coalition of community-based organizations in East Harlem. I first worked on pediatric mental health, and then I spearheaded, along with many other medical students and residents and faculty, a partnership between that community-based coalition and Doctors for America, a national organization of physicians and medical students. The plan was to increase enrollment of people without health insurance after the Affordable Care Act, and also to track the rollout of this act on East Harlem. While we were doing this, I saw many researchers and institutions enter this community too, and list the things they thought they could do to make the community better. And that's great, that's fantastic. But I want to tell you that East Harlem, Richmond Hill, West Harlem, Hunts Point, many of these communities are not wastelands waiting to be saved. They're vibrant communities full of people investing in making their environment, their community better, and invested in each other's health and well-being. You see, many of these communities suffer from racism and social deprivation. Racism, as per one of my favorite definitions, Dr. Kamara Jones's definition, is a system of structuring opportunity and assigning value based on the social interpretation of how one looks. Nowhere here do you hear me say genetics, biological makeup, or do you hear me say anything else besides how one looks? What many people fail to realize is that there isn't the vulnerable, the underserved, the disadvantaged, and then baseline or normal. Whenever one group of people or a community is disadvantaged, another must be advantaged, right? And benefiting off of the oppression and the social constructs that we construct. In medical school, students often learn to present patients to their preceptors using the history of present illness. All of you can do this. You're applying for residency now, so this is something you're gonna do. And this is a quick snapshot of a patient's life. For instance, 50-year-old male with a history of heart disease and diabetes presenting with chest pain. You need to know that this patient has diabetes and heart disease. It's important to be able to treat this patient's chest pain. Similarly, the past medical history of communities and races cannot be disregarded when we attempt to address the problems that afflict them currently. Innumerable historical events connected with medical and scientific experiments have plagued Black health, communities of color, and their health-seeking behaviors. Racial categories and race are given meaning by the historical context in which they're rooted. Ignoring that history is detrimental not just to our education, but more importantly, to our adequate treatment of our patients. Ignorance, nothing else, but ignorance often allows many people to believe that the days of injustice, often equated to slavery, are behind us. But we're better than that. We like education. We spent 20 years in school. So we must continue to learn about the exploitation of vulnerable human beings throughout history and acknowledge and pay tribute to those who were used for scientific experimentation. Remember that statue just across the park? Yes, Dr. James Marion Sims, who we all adored and respected as a gynecologic surgical pioneer. It took many, many years to get people to know the truth that he got to where he did, using and abusing Black bodies. So I plead with you today, value history. Next, recognize your own biases. Healthcare professionals may apply stereotypes and generalizing techniques to simplify and make sense of the abundant information that they're thrown every given day on a daily basis. But this isn't an excuse. This grouping of people, the Brooklynite, the welfare mother, the homeless man, the alcoholic who comes in after day, becomes automatic and allows us to quickly and unconsciously assign an individual to a group and then give that individual characteristics of that group based on deeply rooted history. This stereotyping is not unique to us as healthcare professionals. However, we need to know that it influences the physician-patient relationship. Think about the last time you greeted a patient in the waiting area of a clinic or the emergency department. Did his or her accent cause you to have automatic thoughts or feelings influencing your decision-making? His or her height, age, weight, color? Think about how these factors influenced your initial thoughts. What about the last time you saw a patient's name on the whiteboard or the chart, medical chart? Did you automatically think, oh no, I'll have to use an interpreter for this visit? Did you think that that name was somehow equated to bad eating habits? If you didn't, great for you. If you did, this is a point where you can check yourself and move forward in a way that's very important going forward. As an extension of the eugenics movement and the need to justify slavery, health disparities were first explained by genetic disparities. Dr. Mary Bassett, one of my mentors, commonly explains that this genetic explanation transformed into a lifestyles explanation. So first, Black people had thicker skin. They didn't feel pain. They didn't feel heat because slavery needed to be justified. Secondly, they're lazy. People are just lazy. They want welfare. They want money from the government. But think about it. What exactly are people choosing? Are they choosing their poor housing conditions? Are they choosing air pollution? Are they choosing to live in areas where policing ensures tragedy as much as it does safety? Are they choosing higher rates of incarceration? Medical students are often encouraged to listen to patient narratives and focus on the impact of that individual on his or her outcome. To me, this is problematic because a person's choice matters, of course it does. But a person's race, social, economic status influences their abilities to live in safe housing, purchase healthy goods, breathe fresh air, and ultimately live a healthy life. As we move away from these untrue, harmful explanations of health disparities, like genetics or solely lifestyle, we must provide training to nurses, medical students, residents, and beyond, informed by a more accurate explanation of inequities. As a medical student, quite frankly, I was sick and tired of seeing injustice on a daily basis. It is crucial to realize that it is not just a systems issue out of the hands of individuals, out of our hands. Because when we see injustice and we turn our backs, when we choose not to say something, when we see it clearly in front of us, we perpetuate this cycle. I saw Black students being pulled aside by security in med school. I saw a very clear segregated care system in New York City at all of our medical centers. I heard physicians commonly referring to the Medicaid patient in the most dehumanizing and condescending ways. I saw government officials too, not our current DOH, Dr. Daskalaskis, Dr. Mary Bassett, Dr. Bill Jordan. Thankfully, we have you. But I saw government officials too, somehow turning away from their duty to create anti-racist legislation. I was also very familiar, though, with the many dedicated people who are working so hard to undo racism in New York City. Faculty at many institutions, CEOs, once again, government officials, medical students, my fellow medical students at the time, residents and beyond. But I felt that so many people were doing this extraordinary work in isolated silos. And it's not just extraordinary, it's emotionally and physically grueling. So with lots of idealism, med student style, Andre style, what I did is I knocked on doors, I called people, I went to community meeting after community meeting, just to get people together, just to try to connect some nodes. This led, because of energy and momentum, to the formation of the New York City Coalition to Dismantle Racism in the health system. Today we've done collective citywide advocacy, but we have a lot more to do. I tell you now, it is not idealistic to want to live in a world of universal health care. Dr. Delagasi, it's not idealistic. It is not idealistic to tear apart this segregated health system and to have one clinic for all patients. Not a clinic for Medicaid patients, not a clinic for patients without insurance, and then another one for patients with private health insurance. One clinic for all patients. It is not idealistic to want basic human rights for everyone, regardless of whether they're an immigrant, regardless of whether they're gay, whether they're black, whether their documentation status. It is realistic with you and your spirit. Today's a Sunday. Look at this room. Most of the people here are under 30. And with your spirit of advocacy and activism and your courage right now, it is realistic. With our unity, it is realistic. So I leave a couple final words for you that I've learned. Listen, when you see something wrong and that gut feeling comes and it's overpowering, listen to that inner spark. Listen to your patients. They know their bodies, they know their communities, they know themselves, they know how they can help you treat them. Learn. Just as much as you like to learn, or maybe you don't, about genetics and molecular biology and all these other things that were taught in medical school, learn about the history of segregated care. Learn about all the things we did wrong and not just the things we did right. Learn the context of their lives, your patients. Be patient. We get really angry, and I love that about us. I love our millennial, maybe I'm a little older than millennial, but I love our spirit because we act with that passion that guides us to the right place. However, we need to realize that nothing can happen overnight. We need to be patient. This work will outlast our entire lifetime. Be patient. Be humble. You and I are lifelong learners. We have so much to learn. The people in here that are not over 30, find them during the breaks. Have them tell you stories, because that's my favorite pastime. Listening to people who have more experience than I do. Learning from them. Love yourself. As I said, this work is not easy. It's very hard. You'll go home after protests, after working in the clinic, after working in the emergency room, and you're going to be tired. Practice this work with self-care. Love yourself. Realize that spark of divinity, of goodness, whatever you want to call it, within yourself, and see it in others. Because when you love yourself, you will love all those around you, regardless of any of these social constructs. Lastly, find your voice and use it. Many of you have found it already, and you are using it. But continue to do so. When you get to residency, things won't get easier. You'll get busier. Then you'll become an attending. Then you may decide to go into government or practice clinical medicine for the rest of your life. Whatever you do, keep realizing that the fact that you've earned a white coat, a stethoscope, or a position of power as a nurse practitioner, whatever you are, however you serve your patients, realize that the greatest thing you can do is advocate for them on a daily basis. Thank you so much for giving me this opportunity. I really, truly do not deserve it, alongside the many amazing speakers here today. But I'm so inspired by all of you, the people in this room. If you have any interest in joining our citywide coalition, I brought flyers with information. Just come find me or find Connor in the back of the room sitting on that table. And make sure you go to his segregated care workshop later on. Thank you all, and enjoy the rest of the day.